In about 2000, I started what became and currently exists as the Black Health Alliance. And the Black Health Alliance was essentially a group of different organizations as well as individuals, health professionals, social service professionals, that I had realized that there is a lot of organizations and people in the community trying to address health issues. So I thought it would be an idea to try to reach out to some of those different groups to form what became the Black Health Alliance. And so that started in 2000 with members from people from Toronto Public Health and Black Cap and the Caribbean chapter, the Canadian Diabetes Association, the Ontario Sickle Cell Association, and many other groups.
At some point, being involved in the Community Health Centre movement, there was a recognition, not just by me, but by many of us, that the issues that relate to the health of Black people were not being addressed. Mainly, whilst Black people could access services in different health centers, they were not really addressing their needs as it related to their history, their culture, what it is that Black people needed when it came to health care. There were certain issues of health that impacted on Black people differently. That the mainstream community health centers really did not recognize in terms of delivering services. So my involvement came about as the Executive Director of Women's Health in Women's Hands, but also as a community activist, always looking out for the health of Black people. And I worked with the Black Health Alliance, became a member of the Black Health Alliance, both in terms of an individual and representing women's health in women's hands, to look at addressing some of those issues.
Part of the reason why I got involved from the outset with establishing TAIBU was because being a Black physician and going through my training and seeing very few Black physicians, it certainly stuck in my mind that, you know, just given the population of Toronto and the significant number of Blacks within the Greater Toronto area, there are so few Black physicians. And we're starting to reach a bit of a critical mass now, but I've always thought it would be nice for us to be able to pull something together in terms of resources, person power, to be able to provide something special for the Black community by Black healthcare professionals.
I think one of the first initiatives, which sort of, at the end of the day, became a part of the foundation of TAIBU, was in 2002, federally, across the nation, there was a commission called the Royal Commission on the Future of Healthcare in Canada. And so I took it to our group and I said, you know what, we really have to take this opportunity and let's make sure we make a submission to the Royal Commission on the Future of Healthcare, putting forward some of our concerns.
We found we were at a loss to find or get any information about any research, the impact of certain health issues on Black people. Every time we spoke of, okay, so what is the statistic or what is the data? We didn't have any research that culminated into any data that would tell us, okay, this is the differential impact. Let's take, for instance, cancer has on Black women, because although Black women get cancer less, they die more.
People from the Black community were disproportionately affected in many of the chronic diseases, HIV and AIDS, diabetes, different types of cancers, mental health, sickle cell, and so forth. That in terms of how you're going to change that situation, it's going to be a combination of doing research. It's going to be a combination of bringing on health professionals that are familiar, that are knowledgeable about the cultural beliefs and the eating habits and our attitudes and belief systems.
And the Black Health Alliance decided to expand, and not just its membership, but to expand the information to others within the community that was involved in health.
In the meetings that we had to develop the application and put the argument together, we had a meeting in January of that year at Women's Health and Women's Hands, and the place was full. Like, we had some of the leaders in the black community as it relates to health. They were all there. From nurses, doctors, physicians, mental health workers, social workers, and they had we had gathered them together and said, listen, this is an opportunity. We need to seize this opportunity to put in an application. And we had a great discussion, great ideas, and great solidarity and great commitment. Letters of support were coming in from all these people, as well as we had begun to get some support among some of the politicians, and we got some support letters from Malvern Curling and the mayor.
At the time that we were looking at this, the government then were really interested in establishing family health teams to deal with issues of health, to deliver health services. And we decided to apply through the process for the family health team, but emphasize to the government that we wanted a community health center because that concept met our needs better than a family health team. The concept was about a holistic approach to healthcare that it took into account the social, economical, racial, all of those social determinants of health in addressing healthcare.
Because the community health center is really the model of care that it offers. It's kind of like a blend of you got health professionals, but you also got programming. So when you look at the health of people, you have to consider that the social determinants of health. So there are other things that play an impact. There could be social isolation. There could be mental health issues. There could be stress. There could be suffering racism. There could be a wide range of things that they need to do. They may need to know about healthy living, about diet, about physical activity, about stress management. And the Community Health Center provides a model and a framework under which not only can you go in and see, a nurse practitioner and get direct information and assistance as it relates to your blood pressure or your diabetes and so forth, but it also marries that clinical care with programming. So it's a place where you can begin to do mentorship programs for young people. You can do cooking for single moms. In 2004, we were able to then have a community forum, which took place in Malvern area. And that was hosted by George Smitherman, who was the Minister of Health, and Marianne Chambers. And at that community forum, we did a presentation, Black Health Alliance, we did a presentation about why we thought a community health center for Malvern would be great, and how it could serve the community. On November 10th, 2005, I got a call maybe about a day or so before saying that there's going to be an announcement by the Minister of Health, George Smitherman, and that we should be there, that the Black Health Alliance should be there. The announcement was going to take place at Malvern Town Centre, and it was in relationship to expansion of the community health centers across the province. And of course, that day was a wonderful day, because that was the day when Minister George Smitherman announced that in addition to the expansion of, I think, several dozens of CHCs across the province, one new CHC was going to be announced for the City of Toronto, GTA, and that was Malvern.
We got a small amount of funding to have the consultants come in and assist us with the application, and there was a lot of back and forth, even among ourselves, as I said, in terms of what the vision was and how we wanted to present it. But some of us were very, very strong in terms of saying, this is the concept, this is how we want it, and this is what we are applying for.
I guess maybe late 2004 that Jan and I were contacted about working with the Black Health Alliance. At the time, they were working specifically on a project looking at enhancing their organizational capacity, as well as they wanted to look at the development of a community-governed family health team. Part of our work as well was doing some of the background research in terms of making the case, right? So recognizing that the populations that the family health team would be focused on, kind of gathering that information, gathering that research, the evidence, to show sort of, some of the what the situation was like in terms of the different and disproportionate sort of illnesses or health conditions that were faced by the different communities, as well as, the barriers to access. So looking at all of that and gathering as much evidence as possible to help to build the case and to support the application.
It was quite clear that TAIBU was designated, it was going to get its funding, and now we had to put all the pieces in motion to make it work. And that was I was a co-chair of the implementation committee, as I mentioned, and there were a lot of different components that were involved in those early stages. The community health engagement and the document that went forward to the government for proposal, and there were many steps to approval of the process before we finally got the final okay to move forward. My role was to be part of sort of organizing that, coordinating it, and working with the project manager at the time.
In fact, at that time too, a smaller group of people actually came together to specifically focus in on TAIBU implementation. So there was actually a committee called the TAIBU Implementation Committee, and it had people like Chris Morgan, Dominic Sheldon, Miriam Rossi, Vida Stevens. So a number of really key folks, Floydine Charles Friedel, involved with the BHA previously, but also now focusing in on TAIBU.
I would say the community engagement process and then the report that came out of that, the community engagement report, was a key part of the formation of TAIBU. So we went out to the community and we determined what the needs were of the community. So essentially it was a form of a needs assessment.
That work also involved working to define a role called, I think it's project coordinator, to help with more of the on-the-ground, connecting with the community, connecting with community agencies pieces as well. And Kirsley Peters was brought in to help with that piece and did a lot of the work around the community engagement framework, which we were involved in as well.
The other challenge that we had is selling the vision to all the people in the community to ensure that they bought into the vision of what the Community Health Centre represented for the future of the community. And we thought at the very outset that inclusion was really important, that everybody needed to be a benefit from the health center in the community.
This was a community engagement to find out what the community really wanted from a health center. It was almost an introduction as well as to what is a community health center. But it also was a way to kind of get some feedback from the residents within Scarborough here as to what it is their health needs were and what are the specific programs that they wanted. Malvern being a priority neighborhood, it had a high percentage of youth. It had a lot of issues in the community that were deemed as, I guess, a priority neighborhood, but it also provided an opportunity for this community health center to address some of those issues.
The United Way had also recently done a citywide study supported in partnership with the City of Toronto. And what they had identified across the GTA, there were 13 different neighborhoods which were underserved in terms of services and programs and so forth, and Malvern was one of them.
In 2001, we knew that 1 in 5 residents in Malvern were from racialized groups. We also knew that 80.6% of the youth in the Malvern community were between the ages of 15 and 24, and they too were from racialized groups. And so the City of Toronto in 2004 came up with their community safety plan that outlined a couple of things. For example, they talked about the inequitable access of opportunities for racialized youth. And secondly, they talk about the systemic barriers that are presented in institutions that prevent equitable participation. So we knew that that the health center would address some of those barriers and some of those issues of access.
Many of the people who are part of the Black Health Alliance knew Malvern well, and it was an ideal place where we thought we could begin to a community health center would help bring programs and services, and particularly also to reach out to the Black community.
It was a struggle, and I think it's important to emphasize that at that early stage, It was a struggle, and there were times where we felt that TAIBU perhaps would not have come to be just because of the resistance that we got. But through perseverance, through the members of the implementation committee and other people that were very supportive, other people behind the scenes that were very supportive of TAIBU, we persisted, and we were able to get the government to give their final approval.
Jan and I worked with that committee in terms of developing the work plan as to what would be required to actually now, put different kinds of systems in place, particularly around things like governance, so, drafting of bylaws. We also worked with them in terms of, the first executive director, what would that position entail, and, the process for actually hiring that person.
Based on the report from the community engagement process, we had then to plan as to where we're going to start, how we're going to start, and how we're going to engage the community. So the first phase of the organization involved securing a location where we can start the planning and the delivery of program and services. So we were fortunate enough to find one office at 1371 Nielsen Road, just across the road from here. And that was a huge achievement for me, because now I had an office, I had a location, people could call me, people could come to meet with me, and I kind of felt that I now, and TAIBU is existing and is being known in the community. We had two phases with the two key employees at the time. One was to start developing the internal structure of the organization, governance, financial systems, human resources systems, putting policies and procedures in place. The second staff was more involved in getting out, engaging the community, promoting TAIBU, let people know what TAIBU services are going to look like, and also developing key partnerships with both local organizations, local community agencies, and also other local or municipal organizations like the City of Toronto. Third phase, we had additional staff. Now that we know what we were looking for and what we were going to do and who we were going to partner with, then we added a few more community health workers and health promoters to start engaging the community in program and services. The fourth phase was starting our primary care healthcare services, and so the fourth wave of recruitment included clinical providers like nurse practitioners, physicians, food care specialists, and medical secretary to help them with administrative support. With that, we started our primary healthcare services in March of 2009 with a part-time physician, a full-time nurse practitioner, a food care specialist or a chiropodist at 1371. All this time we've been expanding our offices space, so we were looking for more additional space in the building that we were in. And then we continued recruiting more additional staff to expand and enhance our services. Within this time, we also had a huge project that we had to undertake, which included which was the capital project, which is this new facility. The application for the capital project was submitted to the ministry in February 2008, and 3 years after the submission, we are here in our building, which is a very nice building. But that was a very long process. It was very complex and challenging. A lot of planning to do, a lot of designs, concepts to consider, dealing with the landlords, making sure that we were, submitting all the required proposals to the ministry, and that was a huge challenge. In terms of the successes, I think for me, one of the key successes that TAIBU has been able to achieve was engaging the community. As a new organization coming into a community, it's very challenging to establish trust with the community, for the community to understand our framework of programs and services, our rationale, our philosophy of working. And I'm very, very much encouraged to see that we have the full support of the community members here in Malvern, as well as our specialized client group, which is the African and Caribbean community. Every step, I believe, is memorable. Of course, moving into this building, even though it was a very, very tiring task, actually moving boxes and tables and desks and all that, that is a very huge, memorable moment for us. The day or the week that we moved, we had a staff lunch just to celebrate and to thank staff of all the hard work that we have done as a team, and to see everybody feeling energized, feeling at home. That was a very, very emotionally touching moment for me. So TAIBU is an African wish, meaning be in good health. It comes from the Swahili language. The name was coined by the BHA implementation committee when they were discussing about the establishment of primary healthcare service for the African and Caribbean population. Now, when we look at our logo, we also have some inherent meanings and concepts and messages within our logo in terms of the colors. We have the brown that is signifies, or relates to the earth and being grounded. The green, which is about growth and life, and the orange being the creativity and the energy that the organization has, and would also work with the community to make our population be in good health.